Hello, everyone, and welcome to this audio podcast. This audio podcast, as part of a Meteor edition. This audio podcast, as part of a Biome Bullet. This audio podcast, as part of a Lobostics Phantom. This audio podcast, as part of a Storm Lobostics production. In this audio podcast, I sort of look at works from 2000. Look at works from 2019, a sort of research poster presentation from 2019, and works that had been, and where this research poster presentation had been presented at a science symposium in a data science symposium in 2019. Uh, the 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 research poster presentation looks at two main aspects, but where both aspects are linked with what have been sorry with sort of technology in regard to in regard to in regards to medicines use in care and nursing homes, and where the technology at the time had been utilized throughout varying nursing and care homes throughout the United Kingdom, and where at the same time the research poster presentation looked at, and specifically in regard to how the technology how in regard to how the technology used how the technology was utilized in amongst nursing and care homes, for example, to prevent, for example, prevent overuse of particular medicine particular medication or medicines, and also how the technology at the time was used in amongst nursing and care homes to actually prevent sort of where in amongst primary healthcare services, and over sort of prescribing of particular medicines an over prescribing of particular medicines that were not, for example, required, and where the technology also where the technology sort of prompted sort of the a basis in around a basis in around the safety of sort of residents in amongst nursing and care homes, as far as sort of prescriptions for medicines, prescriptions for medicines were is and was required. So a little bit around this. So the technology at the time was referred to as an electronic medication administration record, and electronic medication administration record, and where and where and where sort of at the time was where a hand sort of a hand it was a handheld was a sort of handheld piece of technology that had been utilized for administration of medicines in care and nursing homes, and there in nursing and care homes, and there was a sort of barcode validation to individual to individuals, or amongst residents in within nursing and care homes at individual level. And there was an integrate where the barcode, the sort of barcode validation aspect had sort of a link, had sort of had sort of some aspects of integration with pharmacy, with sort of pharmacy records, with pharmacy records. So where for example, there would be there would be residents within nursing and care homes, for example, who would have their prescriptions from sort of local sort of pharmacy, local sort of pharmacy pharmacy sort of establishments, and where the technology at the time had an element of had an element of integration with sort of the sort of for the sort of the sort of pharmacy record systems within the pharmacy record systems within care within sort of within varying pharmacy establishments, and again a link with sort of the sort of tech, the tech within with the tech that was within nursing and care homes, and at the same time the tech also had information in regard to in regard to prescriptions, dispensing and administration of varying medications for nursing and care home residents. And there was the technology had an aspect of what was referred to, or what was referred to as a sort of a scorecard, which allowed sort of real-time data, if you like, for in and around sort of the analytics of medicines management within nursing and nursing and care homes. At the same time, the 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 technology that was linked with and in amongst industry, and one particular organization, and amongst the industry, in amongst the industry, had a link where the works had informed through some initial data, that had informed that 21 out of 23 administration errors had been eliminated. So had been eliminated, and an average of 65 hours of staff time per month was saving had a saving had by the from the use of the tech, from the tech or technology, had informed that there was a staff that 65 hours of staff time per month had a saving from the use of the technology, and 9 hours per month from the from sort of the informed scorecard analytics. Safety of the of sort of delegation of sort of the medicines administration from from nursing staff also to care to sort of the carer staff, the caring staff, the carers within sort of nursing and care home environs sort of using the tech using the technology. So where, for example, so through this technology, through some aspects of the technology, allowed sort of nursing staff who had varying priorities in amongst the nursing and care home environments, where there were certain higher priorities for nursing and care homes. The technology also allowed to use the technology to also support the administration of medicines or prescriptions within nursing and care homes. And uh, the 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 tech also had some collaboration had collaboration with academia, where there was a where where there was where the collaboration sought to use the electronic medicines administration record data to optimize medicines use in care and nursing homes. And the poster presentation sort of highlights quite in some detail some of the analytics sort of analytics and snapshots that actually were informed from the technology at the time. And real-time data analytics on medicines use at individual and group levels were 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 sort of were accessible through the technology. And reports for further details reports for further details and risk scores using some sort of basic basic algorithms and some basic algorithms were sort of were accessible through the technology at the time. Now going into sort of looking at how some aspects of the technology some aspects of the technology were utilized to sort of to look at and to look at and sort of also prevent sort of polypharmacy. So the use of too many medicines, too many drugs, or too many prescriptions, too many prescription medicines, for example, that could contribute to an effect or an influence on nephrotoxicity, thus being where drugs or certain medications certain medications under certain categories of drugs certain medications under certain drug categories can and could cause renal or kidney renal insufficiency, or kidney insufficiency, or sort of renal impairment. So a little bit in regard to this aspect of this poster presentation. So the aim of the work was to outline an association really between medicines with a particular focus on polypharmacy and renal function. Look at renal function by examining the use of nephrotoxic medicines and medicines that require dose adjustment in amongst renal in amongst in amongst suspect or high risk recipients or sort of residents within within the sort of nursing and care home environment within the nursing and care home environment um, uh, and and in particular and specifically in regard to dose adjustment in aligned to renal impairment. So the objectives were to perform a sort of a retrospective point prevalence descriptive analysis of the use of the technology and data to demonstrate dispensing patterns for nephrotoxic and renal dose adjustment medications in care and nursing home populations. And so, secondly, to identify the original ways to monitor individuals who are at risk for renal impairment using technology in context of primary care, and in primary care more so than in secondary care. And thirdly, to consider potential advantages of identifying individuals using medicines sort of management technology. So a little bit background in and a little bit of background in context of sort of the of a little bit of background in context of the polypharmacy aspect of this polypharmacy aspects of the literature. So healthcare and tech have been advancing sort of rapidly at the experience, uh, as is the experience of as is the experience that healthcare professionals and those that they tend to sort of look after who have become who and where healthcare professionals generally had been accustomed to utilizing technology in day to day. Expanding on sort of data collection to renal insufficiency as well as external data linkages, and particularly to care home in amongst care and nursing homes medicines management would also allow more detailed understanding of which individuals are more at risk of renal insufficiency or renal impairment. And this would pave the way for more transparent transparent sort of medicines management and screening, for example, or screening programs for individuals in amongst nursing and care homes. So polypharmacy definitions and overprescribing has been highlighted has been highlighted in literature. Early interventions and the importance of risk management and prevention is critical in the care of in the care or nursing home population. National Institute for Health and Clinical National Institute for Health and Care Excellence guidelines are aimed primarily through primary care teams. The recommendations aim to address known and unacceptable variations in recognition, assessment, and initial treatment in referral for suspect and high risk recipients, and in context of renal replacement therapy. The inpatient mortality of renal insufficiency varies considerably depending on the severity setting. So intensive care, for example, within intensive care or not, and many other patient related factors. But in the UK, it might be typically 25 to 30% or more, where the where sort of where inpatient mortality varies. In view of its frequency and mortality rate, prevention prevention or amelioration of just 20% of cases of renal impairment would prevent many deaths, or could prevent many deaths, and substantially reduce complications complications and associated costs. So the methodology, or part of the methodology around this works, was where the data used for analysis was provided by within industry of this in around this technology for electronic medication administration records system. And the medicines were coded. The medicines or drugs were coded utilizing the dictionary of medicines, medicines and devices, and the medicines included the nephrotoxic medicines, and medicines that required dose adjustment in renal disease databases were chosen based on investigations that were published within and amongst evidence in around 2007 and 2012. And drugs were grouped by the British National Formulary, or BNF categories, and for nephrotoxic medicines further grouped into four types. That's diuretics, angiotensin converting enzyme inhibitors, or ACIs, and non-steroidal inflammatory drugs, or NSAIDs, and also nephrotoxic antibiotics such as gentamicin. And so the analysis, the poster presentation, within the poster presentation, there is some graphical data, but in 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 as in a sort of a summary of the analysis. Point prevalence descriptive analysis was performed using software. Using particularly a specific software that was aligned to the medicines, the use of the medicines administration records technology, and linked with software within industry. And there were a total of 81,299 items that had been currently in use. 2,946 of these were included in the list of nephrotoxic medicines, and 9,896 were included in either the nephrotoxic or renal dose adjustment medicines list. There were a total of 7,976 individuals, and of these 2,374, around just under around 30% were prescribed at least one nephrotoxic medicine, and 5,278, just above 65%, just above 65% were prescribed either a nephrotoxic medicine, a renal dose adjustment medicine, or both. The results also informed 504, around just over 6% of individuals were prescribed have been prescribed two or more nephrotoxic medicines, and 65, just less than 1% were prescribed three or more. For both nephrotoxic and renal dose adjustment for nephrotoxin and renal dose adjustment medicines, 2,728 were prescribed two or more, around just under 35%, and 1,198 were prescribed three or more, around 15%. The most commonly prescribed nephrotoxic types were, or nephrotoxic sort of drugs, included diuretics, followed by angiotensin converting enzyme inhibitors, or ACIs, and relatively few individuals were prescribed an oral NSAID, around 123, and only one resident was prescribed parenteral gentamicin. So in sort of summary, and then some aspects around practice, and then conclusions. So individuals in care and nursing homes, and especially older individuals, require special care and consideration from prescribers. This is reflected this is reflected, or have been reflected, in a guideline referred to as Medicines for Older People, a component document of the National Service Framework for Older People, from the Framework of Older People, which originally was published in around 2001, and describe sort of how to maximize the advantages of medicines, and how to avoid excessive and inappropriate or inadequate medicines use, inadequate use of medicines used by individuals living living in sort of or yeah in living or are in within in amongst sort of care and nursing home environs. And with regard to with regard to age, in context of the medicines for older people framework or document, the most important effect is the most important effect, where medicines are prescribed that can prompt the sense of renal impairment, is where there can be the effect of reduced renal clearance. Older individuals excrete drugs slowly and are highly susceptible to nephrotoxic drugs. An individual stabilized on medication, on particular medication with a narrow therapeutic window can rapidly develop adverse effects in the aftermath of symptomology such as myocardial infarction, or respiratory tract infection. the hepatic metabolism, of particular soluble drugs, is also reduced in amongst this population, because the liver function has a reduction in volume. So again, this is a particularly important for drugs with this particularly important with in drugs and medicines with a narrow therapeutic window. So in regard to sort of the in regard to context of healthcare practices or healthcare practice, so polypharmacy is commonly experienced by individuals, can be commonly experienced in amongst individuals in care and nursing homes, and is often a result of multi morbidities. It is not always it is not always inappropriate. However, it becomes problematic if the drawbacks and risks experienced by individuals outweigh sort of the advantages or potential benefits of particular prescribed drugs or prescribed medications. Digital technology and data science techniques can be utilized and had been utilized to improve the identification of individuals who may be at risk from particular specific medicines and drugs, and thus reduces delays in review, monitoring, and referral to specialist services, if and where necessary. And with regard to renal function, the use of nephrotoxic medicines may be appropriate in some individuals. Similarly, individuals with renal impairment that may benefit from medicines that require dose adjustment. In these cases, there should be consideration as to whether the individual would benefit from more sort of refined renal screening methodology. So amongst literature, there have been varying biomarkers, or what have been referred to as biomarkers, to varying biomarkers that are used to determine renal function, and in amongst some literature, but also in amongst sort of in amongst sort of some sort of some in amongst some sort of additional evidences, certain biomarkers, and certain use of certain biomarkers may have more advantage in for example, in older populations versus in amongst other populations, and where vice versa, where other biomarkers may have advantage in younger populations, than in older populations. And so for example one biomarker for example, cystatin C, to improve the accuracy for individuals where using creatinine as a biomarker may be problematic. And so maybe yes. So for example, may be problematic, and so And so some sort of final sort of conclusions as part of this poster presentation from 2019. So the uptake of technology across healthcare and data across across healthcare facilitates sort of facilitates important aspects of data collection, data science techniques, facilitates sort of important sort of data science techniques, and data science techniques at the same time can be utilized or had been utilized to draw insights from technology. Individuals prescribed nephrotoxic medicines and drugs requiring dose adjustment amongst renal disease, or where renal disease is and was concerned in the care and in the in excuse me in amongst the care and nursing homes, in amongst care and nursing homes can be and have been more easily identified using technology, using the electronic medicines administration record data around the electronic medicine administration record data, and where amongst nursing and care homes, individuals may benefit, may find it may be more beneficial or advantageous for a sort of refined laboratory renal screening techniques and sort of utilization of biomarkers that are not and have not been have not been used sort of more routinely. So, for example, cystatin C versus serum creatinine in amongst the older population. That draws this audio podcast to a close. This audio podcast, as part of a Meteor edition, this audio podcast is part of a Biome bullet. This audio podcast as part of a Lobostics Phantom, and this audio podcast as part of a Storm Lobostics production.